I'm Eve Lyon, Recovery Navigator for CareerSource Research Coast. St. Lucie Recovery Works is an initiative supported by the Florida Department of Economic Opportunity. My focus is to connect the social service and treatment service providers and the judicial and law enforcement systems to the workforce development community with the goal of improving employment outcomes for people with substance use disorder. The Centers for Disease Control and Prevention estimated there were more than 109,000 drug overdose deaths in the United States during the 12-month period ending in March of 2022. In the past month, there were 21 opioid-involved fatalities on the Treasure Coast. Employment provides important structure as well as meaningful purpose for all people. For people in recovery, employment supports long-term recovery associated with better quality of life, greater self-esteem, and happiness. Each month, I invite guests to join me in conversations about recovery, second chance employment, and the community-based services that support these outcomes. We know that prevention is the best course of action. However, with appropriate treatment, people in recovery are making great contributions to our workforce. We know that addiction is a disease, not a character flaw, and that recovery is possible. The good news is that 3 out of 4 people who experience addiction will eventually recover. Tonight, we are featuring the dedicated leaders of our Treasure Coast Opioid Task Force. Dallas Sproul and I are co-chairs of the task force, and we're fortunate to have the chairs of our subcommittees here as well. Dallas, welcome.
Hi Eve, it's great to be here.
Thank you. You lead the Florida Department of Health OD2A project. We want to hear what that entails, but first, can you give us some background on the Treasure Coast Opioid Task Force?
Yes, I'd love to do that.
Thank you.
The Treasure Coast Opioid Task Force was formed in order to address the local opioid crisis through awareness, education, and responsive action. There are nearly 200 members along our Treasure Coast area, including St. Lucie, Indian River, Martin, and Okeechobee counties, and we've recently grown outside of those boundaries as well. Members represent a variety of organizations, including substance use treatment, mental health, city and county staff, law enforcement, and the Department of Health in St. Lucie County.
Very comprehensive, and we're ever growing. And we're also ever recruiting, so we're always looking for new participation. What are the values of the task force?
So the values of the task force are, number one, to partner with local treatment providers to assist those needing recovery services. After that, we would talk about reducing stigma associated with opioid disorder. Next, we would identify, intervene, implement, and innovate community education strategies, and to educate the public.
All very extremely important topics, and I do have to say the work that this coalition does addresses all of those regular basis, and then monthly we do get together and try to look at strategies to continue the work. So what is the Florida Department of Health's priority around the opioid crisis?
The Florida Department of Health has included opioid use as a priority in the State Health Improvement Plan. However, understanding that standard treatment programs have had limited success in creating long-term recovery, the Florida Department of Health, the Florida Department of Corrections, and Healthcare Alliance partnered to launch an innovative new program in November of 2022 called CORE, C-O-R-E. That stands for Coordinated Opioid Recovery. The CORE approach is a more collaborative approach of treating the whole person by expanding every aspect of overdose response and treats all primary and secondary impacts of substance use disorder. This is designed to disrupt the revolving door of addiction and overdose. The CORE program is currently being implemented in at least 12 pilot counties, plans to expand in more counties in the near future.
So what does the OD2A acronym mean?
OD2A stands for Overdose Data to Action. The goal is to reduce opioid overdoses and fatalities by gathering data about what is happening to help determine activities for our community partners at the state and local level. This has a special focus on collaboration to help ensure that our efforts will proactively impact the issues of opioid misuse and opioid use disorder while reducing overdoses and fatalities as a combined effort with other community agencies and partners.
And what is some of the important data that you are tracking and reporting?
Well, we track hospital emergency department visits that involve overdoses. We also track and evaluate data related to law enforcement and emergency medical service responses in our community. Additionally, we communicate with the medical examiner's office regarding fatalities.
And how can data inform and influence local planning on prevention programs?
This data helps us to see trends and hotspots. This information helps agencies such as law enforcement and emergency medical services to focus their resources on specific areas for prevention and emergency treatment efforts in order to save lives and make our community safer.
Well, thank you for that work. What insight would you want to share with the community from your experience working in this field?
I would like to share that this is a real crisis, and whether we want to admit it or not, it's in our own backyard. We need to be open-minded, supportive, and responsive by doing things such as saying no to stigma and to judgment. We need to be humble, be sincere, and care enough about ourselves and the others around us to get help for yourself, someone you know, or for family and others that are being affected. I'd rather have a somewhat uncomfortable conversation with someone who needs help now, rather than attending a very uncomfortable funeral for them later.
Great guidance. We are in an overdose epidemic versus an opioid epidemic, and buying drugs on the street is a game of Russian roulette. From Xanax to cocaine, drugs or counterfeit pills purchased in non-medical settings may contain life-threatening amounts of fentanyl that can be 50 times more potent than heroin and 100 times more potent than morphine. Dallas, I want to thank you for your time, and my next guest is going to tell us about some of the work of the local Port St. Lucie Police Department. Police administrators across the country are recognizing the need to connect individuals they come in contact with in the community to evidence-based treatment for substance use disorders. As gatekeepers of the criminal justice system, police play a vital role in preventing and intervening in the cycle of offending and advancement through the criminal justice system, as they frequently encounter substance-using individuals and their families in the community. They often have repeated contacts with individuals suffering from substance use disorder, and diversion can reduce the large social and economic burden on the community. Tonight, I am pleased to have our newly appointed diversion detective of the Port St. Lucie Police Department, Detective Hewlings. We are enthusiastic about your recent appointment and want to learn more about your goals and objectives. Can you speak about the program you'll be facilitating and how it will roll out in the community?
The program was established to help connect resources in the community with the front lines of where the problem occurs. We're going to be making contact and speaking with the people in the community that need assistance in real time. We'll be able to provide immediate help and long-term assistance to our community partners. The position itself is about making the connection between the people in need with local programs and agencies that can provide the help.
And I know you jumped right in with both feet and both arms, so we're grateful. I know already some people that you've interfaced with are in treatment and changing their lives, so thank you. We know that evidence-based studies have proven that diversion results in positive outcomes on future recidivism, incarceration, and overdoses. Can you speak about the proactive policing approach followed by the Port St. Lucie Police Department?
Yeah, you're right. Studies have shown that when agencies are proactive in addressing addiction issues, it results in reductions in future crime and recidivism. The position is going to be proactive in the sense that we're meeting the victims of overdoses where they're at in real time. We're not sitting back and waiting for someone else to help them. We're going out and making sure that they have access and can get contact with the people that provide the help. Much of the process is immediate in their time of crisis, so we're not sitting around waiting for it.
Right, and that really makes a huge difference. And I know that you've also interacted with peers to help along the way who have lived experience, so they've been through it themselves and can really also be role models for change.
Yes, absolutely.
So the program is just rolling out, but I would predict that you're interested in connecting with local service providers to link individuals and their family members to peer support services, linkages to appropriate care, education on the disease of addiction, harm reduction services, safety education, parenting education, education on co-occurring health care needs for those who suffer from substance use disorder and their loved ones. So how can the community connect with you to provide these resources if they have them available?
Yeah, of course. We're absolutely looking to connect with the community in any way possible that would be beneficial for the program. We would like to place each person suffering with an addiction to the program that is best suited for the individual success. So the more programs, the better. The best way to reach me would be to email me at chulings, that's CHULINGS at cityofpsl.com, and I'd encourage any healthcare provider or local organization who believes that they can benefit the program to reach out to me.
And then also we always promote, if anybody is listening who is in need, call 211. Their resources are available. They don't necessarily provide direct service, but they would direct you to whatever services you need that are available in the community, and that's a free service. In an emergency situation, please always remember you want to call 911. And I also am available for both people who might be looking for treatment services or community partners who would like to join in our conversation. And I can be reached at elyon, ELYON, at careersourcerc.com. So if someone is listening tonight and would benefit from a conversation to connect to the previous mentioned resources, again, we want to say it's chulings at cityofpsl.com or me. So you'll be collaborating with other departments to encourage effective strategies for working towards achieving drug-free neighborhoods. Is that true?
Yeah, I mean, I will collaborate with any department or agency that want to work together that have a vested interest in improving the outcome for our community. As far as departments within the Port St. Lucie Police Department, yeah, we're looking to let them know that I am available now and that we have another resource, so that the training is going out, that they know that my position is now available, and we're not just going to send them to the hospital, that we're going to get them further help when somebody does overdose.
Right, and I know the goal is for this to become a model program, and that you'll then eventually share your best practices that you've developed locally. Is that?
Yes, absolutely.
Yeah, that's what the goal is. Great. So since we're featuring our Treasure Coast Opioid Task Force leadership, we should mention that the recently appointed Commander of Special Investigations for the Port St. Lucie Police Department, Michael Swanchak, is chair of the Treasure Coast Opioid Task Force Law Enforcement and Public Safety Committee, and that committee is currently working on developing goals and initiatives for this year, and we look forward to hearing about those strategies. We know that one important call to action is to attain 100% participation of law enforcement agencies providing data and attending our monthly meetings. Did everybody hear that? So what message would you want to share with the community at large?
I know the disease of addiction affects our community in a big way and through many aspects that most people don't even see the totality of. I know that addiction can tear apart families and destroy communities. The disease knows no boundaries and can appear anywhere. I understand that most people would love to just dismiss an addict and let them be left to their own demise. I don't look at the situation through that lens. I refuse to prescribe to that ideology. I know that victims are only one good decision away from turning their life around. I want them to know that we're here to help and support them with the treatment and services needed.
Corey, thank you so much for that beautiful message, for the work that you're doing, and for your time tonight. I'm really grateful that you were able to join us.
I appreciate you having me.
Next, we will speak with Stephanie Eddowes, National Strategic Alliance Manager at Behavioral Health Centers. Welcome, Stephanie.
Pleasure to be here.
Oh, we're always happy to have you join us. You are also a recovery coach professional and the chair of the Healthcare and Treatment Subcommittee of the Treasure Coast Opioid Task Force. How do you connect people or family members seeking treatment services?
So I have been in the treatment space. As you said, I work for a treatment center now. I've been working there since 2011. And throughout that time, I've had the ability to amass a rather large resource list. So I connect with hospitals, treatment centers, recovery coaches, interventionists, whoever comes into contact with someone that needs to get into treatment, and then from there provide the resources based on each individual's needs.
So you are well connected in the community among the sober housing and treatment service providers. How can someone contact you if they are seeking help for themselves, a friend, or a family member?
So I can be contacted obviously by phone. My main work number is area code 561-815-3632. Or you can reach me by email at Stephanie Eddowes, and that's STEPHANY.Eddowes, EDDOWES, @gmail.com.
Okay, I didn't do the go get your paper and pen, so we'll give you a second to do that, and we'll give you her phone number again. That's 561-815-3632. And then you also have a Facebook presence, and you're on LinkedIn as well?
Facebook
Yeah.
and LinkedIn.
So if somebody just puts your name in, they're probably going to find you somewhere. So that's STEPHANY, last name EDDOWES.
And you can also go to the task force Facebook page as well,
Absolutely.
and that'll have all of our contact information.
So I know you're passionate about advocacy regarding stigma. Dallas mentioned stigma earlier. It's such an important topic for all of us. What message of hope and encouragement would you share on that topic?
So we're still a long way from solving the stigma crisis in this country and obviously in this county. We continuously fight for education in the community to help people understand that addiction is a disease centered in the brain. It's not a moral issue. Most addiction is a symptom of an untreated mental illness. So if you're struggling with a mental illness, and that means depression, anxiety, or any type of mental illness, and you have a substance use disorder, we're still a long way from solving the stigma crisis in this country and as well as in this county. We continuously fight for education in the community to help people understand that addiction is a disease centered in the brain. It's not a moral issue. And most addiction is a symptom of an untreated mental illness. So if someone you love is struggling with a mental illness or substance misuse, you can call me directly and I can help you find the right treatment center or resource the first time effortlessly.
Right, and even the right approach
Right.
to have the conversation, because that's a big part of it too, and learning how to speak to somebody, address them in a way that is not blaming, but is helpful, right? So you're also here tonight to speak about your role as the chair of the Treasure Coast Opioid Task Force Healthcare and Treatment Subcommittee. What are some of your goals and initiatives for this year?
Well, we have many goals this year. The one that is in the forefront right now is putting together a list of resources for the community. I know that 211 does a great job, but unfortunately there's case managers at hospitals and all kinds of other places where people go to try to get treatment, and there's no master list that breaks down.
Where someone can go.
Correct.
Yeah.
Where someone can go for treatment.
Yeah.
Correct.
So you're going to try to have a master list that's updated on a pretty concurrent basis, so that if somebody does, an organization closes or moves away, we're not sending people on a goose chase. That's the
Correct.
big deal, is we want to send people to a place where they can get help
And
immediately.
Right, and we want them to get a quality treatment program or mental health program, something that we've vetted and make sure that still open.
We're very excited to have this resource. Really grateful for the work of your committee. So how can someone listening tonight connect with you if they would like to join your committee or one of your terrific networking groups?
Again, just call or email me. Go on the Treasure Coast Opioid Task Force Facebook page and connect with me there. And I absolutely am in need of more passionate people in this space that can provide more resources. So if you're a provider and you want to get on the list, or if you want to just help us to vet and to get people involved, we'd love to have you. And that's whoever you are. We're looking for more members.
Okay, so stephanie.eddowes@gmail.com. Open invitation. We need all the help and all the brain power that we can accumulate in the community to help work together to solve this problem and to spread the great work that's available to help people in need. Thank you so much for your time and for the work that you do and all of the resources that you're bringing to the community. I really appreciate it. Our final guest is Michelle Miller, Human Services Administrator for the Martin County Board of County Commissioners. Michelle, welcome.
Thank you. Thank you for having me, Eve.
Really happy to have you here. You are the Human Services Administrator in Martin County. What does that work entail?
Well, our office in Martin County provides a lot of services for the residents of Martin County. We have several programs that are offered through our office. Some of them are, just to name a few, we have a housing program, we have a homelessness prevention and a social services program, we have a youth prevention program that also has a tobacco-free Martin County component. Veteran Services is part of Human Services, so we serve the veterans in our community. We have a new grant that we're super excited about, and it's called Mental Health Awareness. So we're going to be able to go out into the community and help to train individuals that are interested in learning more about how they can help people that do have a mental health issue. We also participate in the specialty courts in Martin County, so our drug court and mental health court. And then finally, we provide some opioid information and resources through our office.
Really, really important work, and we're grateful that you're here to talk about it. So I noticed the CPM credential on your contact information. What does that signify?
Certified Public Manager.
You also, you have a master's degree in criminal justice as
I
well?
do, from
Okay,
FIU. Thank you.
So you're well versed in the population in really being able to address their needs. So thank you. What are some of the programs operating in Martin County to address the local opioid crisis?
Well, first of all, we're working with our local Department of Health on the OD2A, and we have a lot of outreach that we do through that program. We try to get out into the community and let people know what that grant is able to offer. So we're in the process of developing a plan right now to see how we can best utilize those funds in Martin County.
Okay. I heard a little birdie told me that there might be some resources for transportation assistance.
Yes, there
Yeah.
may, which we find is, a barrier for a lot of people to get to treatment. So one of the primary ways we want to be able to use that funds is through transportation.
Excellent. Yeah, our entire Treasure Coast suffers from lack of reasonable and accessible public transportation, so that's a great thought. So if someone is listening tonight and would want to investigate resources for themselves, a family member, or a friend, how should they reach out?
Well, we employ a case manager that works specifically with our OD2A grant. Her name is Maria Valls, and she can be reached at 772-382-9200. And she's available anytime to talk to anyone, to provide resources, to provide information, or, if someone's just wondering about a family member, she can, come alongside you and help to give you the right avenue to walk through.
And then also, if anybody is interested in learning more about some of the resources that we talked about earlier, they could always go to the Martin County website, which is martin.fl.us.
Yes, and then just put in the search option Human Services, and all of the services that we provide will come up.
You're also with us tonight to speak about your role as the chair of the Education and Prevention Subcommittee on the Treasure Coast Opioid Task Force. What are the goals and initiatives for your committee, and what are you working on for this year?
So we usually meet once a month, probably the third Tuesday of each month, and we work as a 4-county partnership. So it's us, St. Lucie, Indian River, and Okeechobee, and we work on providing prevention information to our community. We gather all the information and then disseminate that to the group so everybody will know what's happening in each individual county. And then we also want to work on providing a few events each year where all of our counties can come together and be able to collectively talk about what we're doing on the Treasure Coast to provide information on opioid use and substance abuse disorders, and provide resources to the community on where they can go for help if they desire.
When you talk about resources, I know that you focus on both prevention, treatment, and celebration of those in recovery. So it's really looking at the whole picture.
Yes.
And we're in the planning stages for the Treasure Coast Opioid Awareness Symposium coming up with Drug Enforcement Administration. That's going to be held on May 11th, but you have to stay tuned. We haven't selected a venue yet, so more to come on that. So how can someone get involved if they want to help you out on your committee?
So we're always looking for new members, people who are interested in being involved. They can contact me directly at my email address, which is mmiller@martin.fl.us. And then you'll be able to get on our invitation list and come to our meetings, which are held on Zoom monthly.
It's the third Tuesday each month,
It
virtually?
is, yes.
Yeah, great. So all of the people that have talked tonight are all recruiting new members for the work they're doing on their committee. And I have to say that, the Treasure Coast Opioid Task Force is 100% volunteer-led. So most of the work does happen at the committee level. And we really want to encourage anyone listening to join in with the work and with the messaging, reducing stigma, providing resources, all of the above. So what closing message would you want to share with the community at large?
Well, I'd just like to share that, as a 4-county partnership, we really are trying to do what we can to address this problem in our area. We really want to be able to help in whatever way we can to reduce overdose and deaths in our community. We want to get the word out that resources are available, and we want to also get the word out that we are providing opportunities for people to get information at certain events or certain different mechanisms throughout the Treasure Coast area. But we often find that people will say, I need help, I don't know where to go, and we just want to say that there are resources available, there is help available. We just want to be able to provide a springboard for someone to be able to obtain that information.
Thank you so much, Michelle. And I guess when we keep talking about Tri-County and Treasure Coast, we should say the specific counties. So it's Martin County, St. Lucie County, Indian River County, and Okeechobee County as well. So it's really a 4-county coalition. Thanks to all my guests. We're going to invite Dallas back to give us some resources on a very, very important topic, which is an overdose remedy that saves lives. So Dallas, Narcan is a very, very important tool that is used by the general public, emergency responders. Can you talk a little bit about it?
Absolutely, I'd be happy to do that. Narcan is an opioid reversal antidote. It temporarily reverses the effect of an opioid overdose. Narcan has become more widely available on the Treasure Coast as well as the state of Florida. I'd like to mention some of the places that people could actually obtain some Narcan kits and doses so that they can make an impact and get it into the hands that need it the most. And what I'd like to say is that it would be available at the Florida Department of Health in St. Lucie, which is Milner Drive off of Midway, also at Right Life Services, New Horizons at the Treasure Coast, the Hands Clinic, and also Mustard Seed. And of course, there's the isaveflorida.com website that is operated by the DCF, and that has a Narcan locator for you
great.
Your zip code and mileage radius that you would.
Oh, well, that's a great tool. Narcan, if anybody's concerned about administering it, it cannot harm anyone. It's a nasal spray, but it definitely can reduce and turn around an overdose situation until emergency services get there. So please think about it's in all my vehicles and in any of the places that I frequent. I really try to encourage having that on hand. So I'd like to thank all my guests tonight for the very informative information they shared. These resources are very important to preserve life and build safer communities. CareerSource Research Coast offers programs for job seekers and employers. Please visit our website at careersourcerc.com. You can also register in employflorida.com as a job seeker or an employer to connect to many support services, or feel free to reach out to me personally for either employment support or any of the other resources that we talked about tonight at elyon, E-L-Y-O-N, at careersourcerc.com. Thank you for listening. Please tune in next month at 7:30 on March 27th to hear from our CareerSource Research Coast Business Services team.